Dermatologists are shocked by what they're seeing. Every single day, seniors walk into clinics looking 15 years older than their actual age, not because of genetics or some rare condition, but because of 5 simple skincare mistakes they've been making for decades. And here's the incredible part. When these mistakes are corrected, skin transforms so dramatically within just 6 months that even grandchildren notice the difference. Today, we're diving deep into expert dermatologist advice to reveal the 5 most common and most damaging skincare mistakes that seniors make. Mistakes that are literally stealing years from your appearance and, more importantly, compromising your skin's health and protection. If you're over 60 or caring for someone who is, stay with me. What I'm about to share, based on decades of dermatological research and clinical experience, could quite literally turn back the clock on your skin. Let's dive in. The information you're about to hear comes directly from board-certified dermatologists who specialize in geriatric dermatology, that's skincare specifically for the senior population. These experts have treated tens of thousands of patients aged 60 and above, and they all agree on one thing. Aging skin doesn't have to look old or damaged. Now, before we get into these 5 critical mistakes, I want you to do me a favor. Hit that subscribe button and turn on notifications. We publish evidence-based health content every week specifically for the senior community, and we don't want you to miss out on information that could genuinely improve your quality of life. All right, let's get started with mistake number 1. And I have to warn you, dermatologists say this one is so common, you're probably doing it right now. Mistake number 1, overwashing your face and using harsh, drying cleansers. Now, you might be thinking, but I was always taught that cleanliness is next to godliness. I wash my face 3 times a day to keep it clean. And that's exactly what dermatologists hear from 7 out of 10 senior patients in their first appointments. Here's what dermatologists explain is really happening. As we age, particularly after 60, our skin produces significantly less sebum. That's the natural oil that protects and moisturizes our skin. Studies show that sebum production drops by about 65% in women and 40% in men by age 65. When you wash your face multiple times a day, especially with traditional bar soaps or harsh cleansers containing sulfates, you're stripping away the small amount of protective oil your skin still produces. This creates a vicious cycle. Your skin becomes dry, you feel like you need to wash more because it feels uncomfortable, which makes it even drier. One dermatologist shared the story of Margaret, a 72-year-old patient who came in with severely cracked, flaky skin that looked almost leathery. She was washing her face 4 times a day, morning, after her walk, before dinner, and before bed. She thought she was being hygienic. Within 2 weeks of switching to a gentle, pH-balanced cleanser and washing only once daily in the evening, her skin's moisture barrier began to repair itself. After 3 months, the difference was remarkable. Her skin looked plumper, brighter, and honestly, about 8 years younger. Your skin has a protective barrier made up of lipids, essentially fats, that lock in moisture and keep irritants out. When you over-cleanse, you damage this barrier. Once damaged, your skin loses up to 75 times more water than healthy skin. This leads to deep wrinkles becoming more pronounced, age spots appearing darker and more numerous, increased sensitivity and redness, sagging skin that loses its elasticity, and a higher risk of skin infections. Here's what dermatologists recommend for every senior patient. Cleanse once daily in the evening. Use a creamy, non-foaming cleanser. Look for ingredients like ceramides, glycerin, or hyaluronic acid. Avoid anything labeled antibacterial or deep cleaning. In the morning routine, simply splash your face with lukewarm water. No cleanser needed. Your skin hasn't accumulated dirt while you sleep. Follow the 30-second rule. Cleansing should take no more than 30 seconds. Use gentle circular motions, no scrubbing. Use lukewarm, never hot water. Pat dry, don't rub. Use a soft towel and gently pat your face. Leave your skin slightly damp before applying moisturizer. Dermatologists consistently recommend these affordable, accessible options: CeraVe Hydrating Cleanser, La Roche-Posay Gentle Hydrating Cleanser, and Cetaphil Gentle Skin Cleanser. These are available at most drugstores and specifically formulated for sensitive, aging skin. Remember, clean does not mean stripped. Your skin should never feel tight, squeaky, or uncomfortable after washing. If it does, your cleanser is too harsh. Okay, let's move on to mistake number 2. And dermatologists say this one actually makes them frustrated because the beauty industry has been misleading people about this for decades.
Mistake number 2, skipping sunscreen or only wearing it at the beach. Here's the truth. If you're not wearing broad-spectrum SPF 30 or higher every single day, you are aging your skin exponentially faster. And no, sitting by a window, driving your car, or even being indoors with light coming through doesn't give you a pass. According to the Skin Cancer Foundation, up to 90% of visible aging is caused by sun exposure. Not genetics, not your age, the sun. That means those wrinkles, age spots, leathery texture, and sagging you're experiencing, 90% of that is preventable. For seniors specifically, here's what concerns dermatologists most. Your skin has already accumulated 60+ years of sun damage. Every additional unprotected exposure compounds that damage exponentially. UVA rays are the aging rays. They penetrate deep into the dermis, break down collagen and elastin, cause wrinkles and sagging, and pass through windows and clouds. UVB rays are the burning rays. They damage the skin surface, cause sunburn and skin cancer, and increase age spot formation. Blue light from screens and indoor lighting, emerging research shows it accelerates skin aging and causes hyperpigmentation. Here's a case study that dermatologists often cite. Identical twin sisters, both 69 years old, came in for consultations. One had been a postal worker who spent hours outdoors without sunscreen. The other had worked as a librarian indoors. The difference was staggering. The outdoor twin had skin that looked 15 to 20 years older, deep wrinkles, prominent age spots, significant sagging, and multiple precancerous lesions that required removal. Her sister, with identical genetics, looked remarkably younger with minimal sun damage. This isn't about vanity, this is about skin health and cancer prevention. Let's address the senior sunscreen myths. Myth: I have dark skin, I don't need sunscreen. Truth: darker skin has more melanin, which provides about SPF 13 protection naturally. You still need additional protection, and you're still at risk for skin cancer. Myth: it's cloudy, so I don't need protection. Truth: up to 80% of UV rays penetrate clouds. Overcast days can still cause significant damage. Myth: I'm only outside for a few minutes. Truth: UV damage is cumulative. Those few minutes add up to hours of exposure over weeks and months. Myth: sunscreen causes more harm than good. This is dangerous misinformation. The overwhelming scientific consensus confirms sunscreen safety and critical importance. Myth: I'm too old for it to matter. Truth: your skin is actively aging every day. Protection now still makes a tremendous difference. So here's the correct approach for seniors. Choose the right formula. Use mineral sunscreens with zinc oxide or titanium oxide. They're best for sensitive senior skin. Look for SPF 30 to 50, broad spectrum, and water resistant if you're active. Apply generously. Use 1 full teaspoon for face and neck. Most people only use 25% of the needed amount. Don't forget ears, neck, chest, and hands. Timing matters. Apply 15 minutes before going outside. Reapply every 2 hours outdoors. Reapply after sweating or washing. Make it the last step. Apply moisturizer first, then sunscreen. Wait 5 minutes between products. For seniors, dermatologists frequently recommend Elta-MD UV Clear Broad Spectrum SPF 46 for sensitive skin, CeraVe Hydrating Mineral Sunscreen SPF 50, and Blue Lizard Mineral Sunscreen SPF 50+. Here's the bottom line. Sunscreen is the single most effective anti-aging product you can use. More effective than any $300 cream, any procedure, any supplement. It's non-negotiable if you want healthy, younger-looking skin. Now, let's talk about mistake number 3, and this one might surprise you because it's something most people think is actually good for their skin.
Dermatologists see this constantly. Seniors come in with red, irritated, peeling skin, explaining they're using retinol, vitamin C, alpha-hydroxy acids, beta-hydroxy acids, and peptide serums all at once because they heard these ingredients fight aging. They're not wrong about the ingredients, but they're completely wrong about how to use them, especially with aging skin. At 65 plus, your skin is fundamentally different than it was at 25 or even 45. It has a thinner epidermis, reduced cell turnover, compromised barrier function, less natural oil production, more sensitivity to irritation, and slower healing. This means ingredients that might have worked beautifully in your 30s can now cause significant damage. Dermatologists call this the skincare maximalist mistake. Patients think more is better, so they use retinol every night, add an AHA/BHA toner every morning, include a vitamin C serum, add a peptide cream, and use exfoliating cleansers. The result? Completely destroyed skin barrier, chronic inflammation, and skin that actually looks older because it's constantly irritated and damaged. Patricia, 71, went to her dermatologist with skin so inflamed and sensitive that she couldn't even tolerate moisturizer. She'd been following an influencer's age-defying routine designed for 30-year-olds. Her dermatologist stripped her routine down to basics: gentle cleanser, simple moisturizer, and sunscreen. After her skin healed over 4 weeks, they slowly introduced one active ingredient, a gentle retinol alternative, twice a week. In 3 months, her skin looked healthier, plumper, and more radiant than when she was using 5 different active ingredients daily. Here's the smart approach for seniors. Start with the basics. Master the fundamentals first. Cleanse, moisturize, protect. Get this right for 4 to 6 weeks before adding actives. Introduce one active at a time. Wait 4 to 6 weeks before adding another. This lets you identify what works and what causes problems. Use less frequency and lower concentrations. Start retinol at 0.025% twice weekly, not nightly. Use vitamin C at 10% formulation, not 20%. Use AHAs once or twice weekly max, not daily. Listen to your skin. Slight tingling is okay, burning is not. Redness should fade within 20 minutes. If irritation lasts more than a day, stop using the product. Instead of harsh actives, focus on niacinamide, which reduces inflammation, strengthens barrier, and minimizes age spots. Ceramides that repair skin barrier, lock in moisture, and reduce irritation. Peptides that support collagen production and are gentle on sensitive skin. Hyaluronic acid that attracts moisture, plumps fine lines, and is suitable for all skin types. And retinol, not retinol, which is a gentler alternative for wrinkles with less irritation. Follow these golden rules. Quality over quantity. 3 good products beat 10 mediocre ones. Consistency over intensity. Gentle daily use beats aggressive weekly use. Protection over correction. Prevent new damage before treating old damage. Hydration over exfoliation. Senior skin needs moisture, not more stripping. Stop use if you experience persistent redness beyond 30 minutes, burning or stinging sensation, increased dryness or flaking, new breakouts, or skin feeling tight or uncomfortable. All right, we're halfway through, and I promise you, these next 2 mistakes are even more critical. Let's talk about mistake number 4, something that 90% of senior patients completely neglect.
Mistake number 4, only taking care of your face and completely neglecting your neck, chest, and hands. Dermatologists call this the face-only fallacy, and it's absolutely devastating to your overall appearance. They've seen patients spend hundreds of dollars on facial treatments only to have their neck and hands give away their real age immediately. The skin on your neck, chest, and hands is actually thinner and more delicate than facial skin. It also has fewer sebaceous glands, less underlying fat support, more exposure to sun damage, and earlier appearance of aging signs. Think about it. How many times have you applied sunscreen to your hands? How often does your skincare routine extend past your jawline? Your neck can show age faster than your face because of constant movement causing deep horizontal lines, less collagen and elastin support, often being completely unprotected from sun, and developing turtleneck sagging. Studies show the neck can age 5 to 8 years faster than facial skin when neglected. The chest area is particularly vulnerable, with very thin skin, constant sun exposure, especially for women with lower necklines, showing every wrinkle and sunspot, and developing a leathery appearance when neglected. Your hands literally cannot hide your age. They're constantly exposed to sun, water, and chemicals. The skin becomes thin, revealing veins and tendons. They develop prominent age spots and show loss of volume. One dermatologist shared a memorable story about a patient who came in for a consultation. Her face looked fabulous, easily passing for 55. Then she reached out to shake hands, and the dermatologist could see she was actually in her mid-70s. Her hands had age spots, prominent veins, and that paper-thin quality that immediately signals advanced age. A 2019 study published in the Journal of Cosmetic Dermatology found that 84% of people judge age by hands, 73% notice neck aging before facial aging, and only 12% of seniors apply the same skincare to neck and chest as face. Another study showed that women who consistently protected and treated their neck and chest looked on average 6 years younger than those who didn't, even with identical facial care. Linda, 68, went to her dermatologist frustrated that despite thousands spent on facial treatments, people still guessed her age accurately. Her face looked great, but her neck and hands were the giveaway. Her dermatologist implemented a comprehensive approach, extended all facial products to neck and chest, daily SPF on hands kept in her car, twice daily moisturizing routine, and monthly professional treatments for hands. 6 months later, the transformation was remarkable. Her overall appearance became cohesive, and she genuinely looked 10 years younger because there was no longer a dramatic disconnect between her face and the rest of her visible skin. For the neck, included in every facial step. Swipe cleanser down to chest. Always apply toners and serums to neck. Use upward strokes with moisturizer on neck. Never stop sunscreen at the jawline. Do specific neck exercises daily. Gentle resistance exercises help maintain muscle tone underneath. And sleep position matters. Back sleeping prevents compression lines. Use a supportive pillow. For the chest, sun protection is critical. Apply SPF 50 every morning. Reapply if wearing lower necklines. Consider clothing with UPF protection. For overnight treatment, use a rich, nourishing cream. Apply before bed to prevent side sleeping wrinkles. Silicone chest pads can help prevent compression lines. Exfoliate gently once weekly with mild exfoliation followed by intense hydration. For your hands, follow the sink side rule. Every time you wash your hands, reapply moisturizer. Keep hand cream at every sink in your house. For sunscreen, keep SPF hand cream in your car. Reapply after each hand washing. Wear UV protective gloves while driving. For overnight intensive treatment, apply thick moisturizer or hand mask before bed. Consider wearing cotton gloves overnight. This makes a dramatic difference in texture. Special treatments include monthly professional IPL or laser for age spots, prescription retinoids specifically for hands, and dermal fillers that can restore volume loss. Expert recommendations for neck and chest include Strivectin TL Advanced Tightening Neck Cream, Revision Skincare Neck Firm, and CeraVe Skin Renewing Night Cream for a budget-friendly option. For hands, Neutrogena's Norwegian Formula Hand Cream, Eucerin Advanced Repair Hand Cream, and CeraVe Therapeutic Hand Cream. Here's a professional tip. Keep your hand cream everywhere. By your bed, in your purse, in your car, by the kitchen sink, in the bathroom. The more accessible it is, the more likely you'll use it consistently. Here's a simple way to remember. Whatever you put on your face should take no more than 3 extra seconds to extend to your neck, chest, and hands. That's it. 3 seconds to prevent years of aging. Your face doesn't exist in isolation. For a truly youthful appearance, everything visible needs care and protection. Don't let these areas give away your age. Okay, we're down to the final and perhaps most important mistake. This one might actually save your life, not just your appearance. Let's talk about mistake number 5.
Mistake number 5. Dismissing skin changes as just aging and avoiding professional dermatological care. This is the mistake that keeps dermatologists up at night. Not because it makes you look older, but because it can literally cost you your life. Too many seniors see a new spot, a changing mole, a persistent rough patch, or a sore that won't heal and think, well, I'm old, this is just what happens. Let me be absolutely clear, not all skin changes are benign. Some are early warning signs of skin cancer, which is not only the most common cancer in the United States, but also highly treatable when caught early. 1 in 5 Americans will develop skin cancer by age 70. Over 90% of skin cancers occur in people over 50. Melanoma risk doubles after age 65. Early detection gives you a 99% 5-year survival rate. Late detection drops that to 27%. Your lifetime UV exposure has been accumulating. Every sunburn from your youth, every day at the beach, every outdoor activity without protection, it's all been recorded in your skin's DNA, and that damage often manifests decades later. Here are the 5 changes you must never ignore. Number 1, the changing mole, a melanoma warning. Use the ABCDE rule. Asymmetry means one half doesn't match the other. Border irregularity with ragged or blurred edges. Color with multiple colors or uneven color distribution. Diameter larger than a pencil eraser, 6 millimeters. And evolving, any change in size, shape, color, or symptoms. Thomas, 73, ignored a changing mole on his back for 2 years. When his daughter finally convinced him to see a dermatologist, it was a stage 3 melanoma requiring extensive surgery and treatment. Had he come in when it first changed, it would have been a simple in-office removal. Number 2, the non-healing sore, basal cell carcinoma. Warning signs include a sore that bleeds, scabs, heals, then repeats the cycle. It appears on sun-exposed areas like face, ears, neck, and arms. May look like a pimple that never goes away. Can be pearly or waxy in appearance. Eleanor dismissed a pimple on her nose for 18 months. When she finally saw a dermatologist, it was basal cell carcinoma that had grown deep into tissue, requiring reconstructive surgery. Early treatment would have been minimal. Number 3, the scaly red patch, actinic keratosis or squamous cell carcinoma. Look for rough, scaly patches that feel like sandpaper, often on face, ears, hands, forearms, or scalp. Pink, red, or brown colored. May itch or cause tenderness. These are precancerous or early cancerous lesions that are extremely treatable when addressed early. Number 4, the rapidly growing bump. Concerning characteristics include appearing suddenly and growing quickly, dome-shaped or warty appearance, may be flesh-colored, pink or brown, and firm to the touch. Number 5, the age spot that changes. Not all dark spots are harmless. New spots after age 60 should always be checked. Any existing spot that darkens, grows, or becomes irregular. Multiple new spots appearing in a short time. Beyond cancer, there are other important changes. Shingles or herpes zoster presents as a painful rash with blistering that follows nerve pathways. It can cause long-lasting nerve pain if not treated quickly and requires immediate medical attention. Cellulitis is a skin infection showing as red, swollen, warm area of skin that spreads rapidly, can become life-threatening, and needs immediate antibiotic treatment. Chronic wounds are any sore that doesn't heal within 2 to 3 weeks, especially common in diabetics, and can lead to serious infections. Here's what dermatologists recommend for every senior. If you're 60 to 75 with no history of skin cancer, get a full-body skin exam annually, more frequent if you have risk factors. If you're 75 plus or have had skin cancer, get a full-body skin exam every 6 months with immediate appointment for any new concerns. Risk factors requiring more frequent checks include history of skin cancer, fair skin with history of sunburns, family history of melanoma, significant sun exposure in youth, tanning bed use, and immunosuppression. Many seniors avoid dermatologists because they're embarrassed or don't know what to expect. Here's what happens during a skin check. You'll change into a gown because the doctor needs to see all your skin, including areas that don't see sun, since melanoma can appear anywhere. Visual examination with dermatoscope is a special magnifying tool. It's painless and takes 10 to 15 minutes. Photography of concerning spots for comparison at future visits helps track changes. Biopsy, if needed, is a quick, simple procedure with local anesthetic. A small sample is sent to a lab with results in 1 to 2 weeks. You should do a self-exam monthly. Here's the 10-minute monthly check. Examine your face and scalp using handheld mirror and wall mirror. Part your hair to check scalp. Don't forget behind the ears. Check arms and hands, palms and backs, between fingers and under nails. Examine chest and torso. Women should lift breasts to check underneath. Check back and buttocks using wall mirror and hand mirror. Ask your spouse or family member to help you. Examine legs and feet, front and back, soles of the feet, and between toes. Call your dermatologist immediately if you notice any spot that's bleeding without injury, a mole that's changing shape, size, or color, a sore that hasn't healed in 3 weeks, a new growth that's rapidly expanding, any spot that itches, hurts, or bothers you, sudden appearance of multiple new spots, or a patch of skin that feels different in texture. The cost of waiting is significant. Early detection means a 15-minute in-office removal with local anesthetic only, minimal scarring, near 100% cure rate, and costs $500 to $1,500. Late detection means extensive surgery, possible radiation or chemotherapy, significant scarring or disfigurement, lower survival rate, and costs $50,000 to $150,000 plus, not to mention the emotional toll. Let's break down the barriers. If you think, I don't have time, skin checks take 15 minutes and could save your life. If you think it's too expensive, Medicare Part B covers annual preventative skin checks, and early treatment is infinitely cheaper than late-stage treatment. If you think, I'm embarrassed, dermatologists see thousands of patients. They're medical professionals focused on your health, not judgment. If you think nothing has changed, changes can be subtle and gradual. Professional eyes catch what you might miss. If you think, I'm too old for it to matter, skin cancer doesn't care about age. Quality of life matters at every age. Early treatment preserves function and appearance. Right now, before you finish this video, dermatologists recommend you pull out your phone, find a board-certified dermatologist near you, and schedule your annual skin check. If you haven't had one in over a year or have never had one, make this appointment today. This isn't about vanity. This is about longevity, health, and maintaining your quality of life. Your skin is your largest organ and your first line of defense. Take care of it. All right, we've covered all 5 critical mistakes. Now let me pull this all together for you with a simple, actionable plan you can start today.
Listen, dermatologists who specialize in senior care have been saying this for years. It's never too late to start taking better care of your skin. Whether you're 60, 70, 80, or beyond, your skin can improve. Dermatologists see it every single day in their practices. Patients who thought it was too late are shocked by how much better their skin can look and feel with just these simple changes. Your skin tells your story, and it deserves care and protection. More importantly, you deserve to feel confident and comfortable in your own skin. If you found this video helpful, please hit that like button and subscribe to this channel. We publish evidence-based health content every week specifically for the senior community. Drop a comment below and let us know, which of these 5 mistakes were you making? And what's one change you're committing to today? We also want to hear from you. What health topics would you like us to cover next? Dealing with age spots? Managing rosacea? The truth about expensive treatments? Let us know. Remember, beautiful skin at any age isn't about expensive products or cosmetic procedures. It's about understanding your skin's needs and giving it the gentle, consistent care it deserves. Thank you so much for watching. Take care of your skin, and we'll see you in the next video. Healthy skin is beautiful skin at every age.